It is my privilege now to welcome our next guest on stage. She has been one of the most prominent voices, female voices especially, on the global stage. She has been the Prime Minister of New Zealand, and she is presently, of course, the PMNCH Board Chair. Let's put our hands together to welcome Ms. Helen Clark on stage, please. And I think we can clap louder than that. Come on. Thank you.
Good morning, everyone, and Sulamat Paji. And great to be here from New Zealand. I see, coming from the Western Pacific region, I'm one of the 17% of the attendees from there. So happy to be holding up the flag for the Western Pacific region. And it's very exciting to be here and to be part of these steps being taken to establish the Global HPV Consortium. I think we all come to this starting line for the global elimination campaign with a sense of hope and possibility, but also realism. It's often said if something was easy, it would have been done by now, and it hasn't been. So we know, the kinds of obstacles we've got to overcome. But as we'll hear time and again today, there are at least 342,000 reasons why HPV prevention and cervical cancer elimination is an urgent and powerful call to action. And those reasons start with the 342,000 women who tragically died of cervical cancer in our world last year. We can add to those the estimated 311,000 who died of the disease in 2018, or every year since then, or before. These numbers add up to more than 1.5 million deaths over the last 5 years. What a stunning number of women dying of a cancer we know we can prevent. But if we don't act decisively, we will see another 1.5 million and more women dying over the next 5 years as well. I first became engaged with the challenge of preventing women dying of cervical cancer when I was New Zealand's Health Minister in 1989 and 90. And it fell to me to implement the recommendations of the Committee of Inquiry into the treatment of cervical cancer at Auckland's National Women's Hospital. And the report of the inquiry, released in 1988, found that there had been a failure to treat a number of women with carcinoma in situ adequately. Women died and suffered agonizing treatment as their cancer progressed because their abnormal smears had not been dealt with. This was shocking and was referred to in the original media report, which exposed it as the, quote, unfortunate experiment, unfortunate, which led to so many deaths. A lot of recommendations came out of that inquiry. It was, for example, the catalyst for full and informed consent for all patients in the health system. It was the catalyst for setting up a Health and Disability Commissioner system for complaints to be made. But relevant to our discussion today, one of its key recommendations was to establish a nationwide quality cervical screening program. And I set that up in 1990. And since then, deaths from cervical cancer have dropped by at least 60% in New Zealand, but they should drop to nothing, right? And one of the challenges we have, and it's one of the challenges we will come up against as we fight for this, is the structural inequalities and disparities. Women from Indigenous minorities and other minorities are more likely to go unscreened, undiagnosed, untreated. So there is ongoing business. Years later, when I was Prime Minister, scanning the news as you do, I read that HPV vaccines had become available. And I said to our government, we've got to get this. And I announced in 2007, I think, the introduction of them in New Zealand, which began in 2008, beginning originally for adolescent girls, but now extended in the age range 9 to 26 for boys and for girls. So having been engaged in these issues for quite a lot of years, the prospect to me that we could have a global campaign which would help us end deaths from cervical cancer is very exciting. We can save the lives of many women, and we can prevent the trauma of deaths from cervical cancer on families. This has to be prioritised, and I might say the more women we get into positions of leadership and decision-making, the more likely it is that it will be prioritised. Women's voices have to be heard on these issues. If we succeed, we could prevent the anguish of the estimated 210,000 children orphaned every year because their mothers are dying young from cervical cancer. We could protect the economic stability of women and families, which is destroyed by cervical cancer, as it tends to strike younger than other cancers and is often killing women during the prime of their lives. But, as I began by saying, we all know we face challenges in trying to prevent HPV and eliminate cervical cancer. Like so many diseases, cervical cancer is not striking evenly around our world and within populations. Almost 90% of the incidence of and the deaths from cervical cancer are occurring in the low and middle income countries, exacerbating global health disparities and meaning that prevention efforts should include sustainable financing and equitable distribution of effort. As I said, within the high-income countries like my own, we see the death rates disproportionately among the more marginalised and excluded. As well, after 3 years of the heat of the COVID-19 pandemic, health funding and resources in so many countries across the board are under greater pressure and often are being dedicated to catching up after the delays to and the disruption of services during the pandemic. And as we all know, we face increasing disinformation and distraction from sources easily accessible, for example, via social media, which crowd the information space with confusing and conflicting messaging. And that increases the difficulties we face in building trust and establishing what the facts are on so many things, particularly when it comes to vaccines. In New Zealand, as I said, we've had free HPV vaccines for all young people aged 9 to 26 and a school-based immunisation program. But our vaccination rate appears to fall somewhat short of the 75% target which is currently set, which itself is too low. We know that achieving widespread prevention is not an easy task. Back around 5 years ago, the Director General of WHO gave a global call, a global shout-out for action to eliminate cervical cancer as a public health problem. And 3 years ago, the World Health Assembly adopted a global strategy to accelerate the elimination of cervical cancer. It included the 90-70-90 targets we're familiar with, getting 90% of girls fully vaccinated against HPV by the age of 15. And by the way, we should say to the World Health Assembly, don't forget the boys. They need vaccination too. Target was 70% of women screened by the age of 35 and 90% of women diagnosed with cervical cancer having that disease treated and managed. That needs to be 100% as well. But meanwhile, strategies are great. Action has to follow. That's why we've got this consortium. The numbers of women diagnosed with and dying of cervical cancer around our world continue to go up. So we come here to Kuala Lumpur knowing that we have to turn that around and fast. We can do it, and we need to create a new paradigm for how we work on these issues. And it has to be based on collaboration. I am board chair of the Partnership for Maternal, Newborn and Child Health, which is headquartered at WHO. And we know collaboration is the basis of getting any results in areas like this. We have a large network of nearly 1,400 partners now across 192 countries and territories, across 10 different constituencies, and we endeavour to bring together all the latest and most relevant evidence about women, children and adolescent health from the community level up. And then we aim to activate our partners around advocacy and commitment to addressing the challenges, and this is one we're definitely getting in behind. We are very engaged with adolescents and young people. If you go to social media and look for hashtag 1.8, this year PMNCH has provided a platform for adolescents and youth to speak up and say what the issues affecting their health and well-being are and what they need addressed. Young people know what they want and they need to be holding decision makers accountable. One of the investments we're calling for is in HPV prevention, and I believe the adolescents and youth organisations, civil society organisations around our world can be one of the most powerful voices for this, demanding this from their governments and from authorities. Let's also acknowledge the evidence which shows important economic returns from investing in the HPV vaccine. You know, all of us come here for this cause because we know it's the right thing to do, but it's also the smart thing to do. In Vietnam, a study showed that every dollar that went into cervical cancer prevention was estimated to yield returns of up to $20 in economic and social benefits. So if the justice of this doesn't move people, maybe the economics of it will. There's a huge payback from these investments. And we've seen a number of countries successfully supporting integrating cervical cancer screening into already existing health services, whether they be for family planning or, for example, for HIV/AIDS. So, coming here today in Kuala Lumpur, we have people from governments, immunisation organisations, supply chain providers, women's advocacy, philanthropic and civil society organisations, all coming together to build momentum and make plans together for this one purpose, cervical cancer prevention. We see the advocates for gender equality and for adolescents and for cancer prevention working alongside the traditional health and immunisation supporters. And it will be so important as we go through today to be hearing the stories of the survivors of cervical cancer. This grounds us, right? Because they will tell us of their harrowing journeys. And wonderful also that we have journalists participating who will help us know how we can best communicate the life-saving benefits of the HPV vaccine and the importance of continuing screening and treatment to prevent deaths. I think if we reach beyond the traditional boundaries of actions on these issues, we can build connections and develop the plans which will eliminate cervical cancer. The possibility of actually eliminating a cancer, wouldn't that be a first? You know, I've had some firsts in my time. I was the first woman to lead a party in a general election, which we won to become Prime Minister in New Zealand. I was the first and only woman to be Administrator of the United Nations Development Programme. And I know that firsts are always celebrated precisely because they are not business as usual. Business as usual is not going to eliminate cervical cancer. Business as usual is not about change. And we are here today about change and accelerating change which will lead to the elimination of cervical cancer. And not in 100 years. Let's set much more ambitious goals for eliminating this cancer. Thank you all for coming to the launch of the Global Consortium. Thank you.
I'm going to request you to stay on for a moment. Thank you for flagging that gender justice is at the heart of this conversation. But I was struck by the fact that you said you began this conversation in 2007. We're in 2023 now. It's taken many, many years for us to get to this point. What is the biggest obstacle in moving forward?
I think it is a question of prioritisation. And our experience in New Zealand was we only started to get major traction on a whole range of issues which are of huge importance to women when women got to the top, got a seat at the table, got voice, could make decisions, right?
You can clap for that.
So, you know, I mean, this is part of a broader struggle, but, you know, that's not achieved overnight either. So whatever the political and decision-making systems and structures we have in our countries, we've got to push this to the top of the agenda. And I'm really thrilled that we have men's support here. No Man is an Island representative has already introduced himself to me from the United Kingdom. We need men's voices because they're affected by this HPV virus, and they too can end up with cancer. It is overwhelmingly a virus which is going to cause cancer in women, but it affects men too. So let's make the links and build the male allies and push it up to the forefront of decision makers' attention.
Thank you, Helen Clark. Thank you. Let's have a big round of applause for Helen Clark. Thank you very much, ma'am. Take care. I think Helen flagged something quite critical. You need the voices of women to be heard. And if you notice, we've already heard from two incredible women. This is not to say that the men have to be excluded or should be excluded or are not critical parts of this conversation. But the fact is that till you actually have vocal women who are willing to hear the voices of women on the margins whose voices can't be heard, Ms. Clark underlined in a way how those on the margins suffer the most. And those voices are only going to be heard if we also make this a conversation about our society, about our people, about the principles of equality, and about the principles of equality between our genders.